Okay, let's dive in. We're tackling a word today that's famous for one thing and one thing only, being ridiculously, outrageously long. We're talking about pneumon ultramicroscopic silicovolcanoconiosis.
Phew, the 45-letter behemoth.
Yeah.
Just saying, it is a workout.
It really is. And, for most of us, that's kind of the end of the story, right? It's a fun piece of trivia, maybe useful for a crossword puzzle.
Hmm.
But actually, hiding behind this linguistic marathon is a genuinely fascinating story about how words are created, how medicine understands disease, and even a surprising real-world connection.
Absolutely. For this deep dive, we've pulled primarily from two key sources. There's a Wikipedia entry that really digs into the word itself,
Hmm.
where it came from, what it means,
Right.
and then a specific medical case report detailing a patient's experience with lung issues that are linked, maybe surprisingly, to volcanic ash.
So our mission today is to move way past just the word's length. We want to understand its strange origin story, break down what those endless syllables actually mean, explore the serious medical condition it's associated with, and then sort of wrestle with this real-world case study that uses the word but seems to add a bit of a twist.
Sounds like a plan.
Yeah.
We've got our work cut out for us. Let's start with that word then.
For sure. You might assume a word like this, describing a medical condition, would come from, centuries of scientific
Yeah.
research.
Seems logical.
But our sources tell a different story. This word was actually coined, believe it or not, in 1935 by Everett M. Smith. He was the president of the National Puzzlers League, the NPL.
That's right. It was basically the invention of word enthusiasts, not doctors initially, and it immediately captured attention. It was featured in the New York Herald Tribune, February 23rd, 1935.
Wow.
Yeah, the NPL announced its recognition of this new, incredibly long word.
And the article even laid out exactly what the puzzlers intended it to mean. It was described as the synonym of a special form of pneumoconiosis caused by ultramicroscopic particles of silica volcanic dust. They were pretty precise.
They were quite specific. And if you look at the word's components, that meaning is built right in. You start with pneumono,
Okay, that's Greek for lungs, right?
yep, lungs. Then you got ultra, Latin for beyond, and microanthrocopic, Greek for small-looking, pointing to how incredibly fine these particles are supposed to be.
Okay, lungs, beyond small, fine particles, then silico.
That's Latin for silicon. Volcano, obviously volcano. And coni, that's Greek for dust.
So lung,
Hmm.
beyond tiny particle, siliconda volcano.dust.
Okay.
And finally, the arisosis at the end.
Right, that's a standard Greek suffix used in medicine. It just means a condition or disease.
Yeah.
You put it all together. A lung condition caused by inhaling very fine silicon volcanic dust.
Got it. And the Oxford Dictionary's definition seems to back this up, calling it an artificial long word said to mean a lung disease caused by inhaling very fine ash and sand dust.
Exactly. It even made its way into official references, like the
Yeah.
1939 Merriam-Webster New International Dictionary,
Yeah.
second edition. It became sort of legitimate.
A legitimate, if maybe slightly quirky entry?
Yeah, and within the puzzle community, it apparently earned the nickname P45.
Yeah.
Simple, efficient, nods to the letter count.
P45. I like it. Okay, so that's the birth and the intended meaning of this behemoth. But now let's pivot a bit. Let's move from this fascinating linguistic construct to the actual medical reality it's trying to capture.
Right. So the word is connected to the broader category of pneumoconiosis.
Hmm.
These are basically lung diseases caused by inhaling various types of dust.
And the specific one most relevant here is silicosis.
That's the one. Our sources describe silicosis as an occupational lung disease, specifically caused by inhaling crystalline silica dust. It leads to inflammation and scarring in the lungs, typically appearing as nodular lesions, often in the upper parts of the lungs.
Okay, standard occupational hazard for certain jobs.
Exactly. But here's where things get really interesting and honestly a bit surprising given the word we're discussing.
Uh-oh.
Our sources, particularly the Wikipedia entry citing research, put out a really crucial nuance. While the word was invented to describe a disease from volcanic dust,
Yeah.
clinical and toxicological research has found, well, little to no evidence that crystalline silica from volcanic sources typically causes silicosis or similar diseases.
Whoa, wait a minute, hold on. So the word, coined specifically for a disease caused by volcanic dust, isn't actually linked to a disease commonly caused by volcanic dust, according to the science.
That's the disconnect. It's
Yeah.
pretty significant. The research suggests that maybe geochemical factors in the crystalline structure of volcanic silica might make it less pathogenic,
Yeah.
less harmful than other forms of crystalline silica. like what you'd find in mining or quarrying.
Huh.
So, despite the word's definition, there's no strong scientific evidence for a distinct disease caused specifically by volcanic silica particle exposures in the way the word implies.
Okay, that is quite the twist. So, if volcanic ash isn't usually the culprit for this kind of specific disease, why did we look at a case study specifically about lung issues from volcanic ash? That sounds contradictory now.
That's exactly the paradox.
Mm.
And that's what makes the medical case report we looked at so interesting. It adds another layer to the story. This report details a case of lung injury due to, and I quote, traumatic inhalation from Merapi volcanic ash.
Merapi, right. That's a very active volcano in Indonesia. I remember the eruptions.
Correct. The patient in this report was a 35-year-old construction worker. He had about 10 months of exposure to volcanic ash near the Merapi eruption site.
Only 10 months. That seems incredibly fast. I thought silicosis was usually a long-term thing. What were his symptoms?
Aggressive shortness of breath, dyspnea chest pain on his right side, and a periodic dry cough. And yes, the onset was remarkably rapid. His initial acute symptoms apparently showed up just 10 days after his exposure began.
Just 10 days. Wow, that is quick. What did the doctors find when they examined him?
Well, the physical exam noted things like hyperresonant sounds when they tapped his chest and diminished breath sounds in certain areas, but the imaging was really significant. His chest x-ray showed a bleb that's like a small air pocket, and a CT scan revealed bilateral multiple bullae. Those are larger air-filled sacs, mostly in the right lung. His white blood cell count was also high, suggesting inflammation or maybe infection.
And did they do a biopsy? What was the tissue diagnosis?
They did. A biopsy was performed, and it confirmed a diagnosis of anthracosilicosis. Now, that's a type of pneumoconiosis, often linked with coal dust, but fundamentally it confirms the presence of dust-induced scarring, fibrosis.
Okay, so silicosis-like disease confirmed.
Yes, and here's the kicker. The final clinical diagnosis given in the report for this patient exposed to volcanic ash found to have this type of fibrosis was pneumon ultramicroscopic silica volcanoconiosis.
Fascinating. So despite that broader scientific understanding we just talked about, that volcanic silica might be less problematic in this specific, very severe case tied directly to volcanic ash exposure, the medical team did use that exact long word.
It really highlights how the word exists out there in practice. Perhaps it gets used to describe the source of the dust, which was volcanic, and the type of lung disease, which was silicosis-like, especially in a patient with clearly very high-level exposure.
Right.
The case report itself suggests the incredibly high concentration of crystalline silica within the ash this particular worker was exposed to was likely the driving factor for such rapid, severe disease. It probably fits into a category called accelerated silicosis.
Okay, let's zoom in on that disease mechanism itself. How does inhaling these tiny particles actually, lead to this kind of scarring in the lungs?
Right, so these are fibrotic lung diseases. The fundamental process, as described in the case report, is that chronic inhalation of these inorganic dust containing crystalline silicon dioxide stimulates fibrosis, that's scarring in the lung tissue, the interstitium.
And we're talking about really, really small particles here?
Precisely. They have to be respirable, meaning small enough to get deep into the lung. The Wikipedia source mentioned less than 10 micrometers. The case report gets more specific, saying less than 4 micrometers to reach the delicate alveolar region, the air sacs.
Okay, tiny. And once they're there...
Once there, these particles encounter lung macrophages. These are basically the lung's cleanup crew, scavenger cells designed to engulf foreign invaders, bacteria, dust, whatever.
But they struggle with crystalline silica.
That seems to be the problem. The proposed mechanism is that macrophages try to engulf the silica particles, but toxic particles like crystalline silica are, well, difficult. They can react with the macrophage's internal contents, potentially damaging or even killing the cell.
Oh, wow.
So when the macrophage dies, the particle and maybe some toxic stuff from inside the cell get released back into the lung tissue. Then another macrophage comes along, tries to clean it up, engulfs the particle.
And the cycle repeats. Engulfment, cell death, release.
Exactly. It's this persistent cycle that's thought to trigger ongoing inflammation, and it stimulates other cells in the lung, called fibroblasts, to produce an excessive amount of collagen.
And collagen is like scar tissue, right?
Essentially, yes. This excess collagen builds up, forming the fibrotic nodules that are characteristic of silicosis. It's worth noting, though, the sources say our full understanding of the body's defense mechanisms against different types of dust is still, evolving.
You mentioned chronic silicosis developing slowly. What about this accelerated silicosis you think might apply to the case patient?
Yeah, so chronic silicosis usually takes a long time, 10 to 30 years after the first exposure to develop. Accelerated silicosis, however, can happen much faster, within 10 years, typically after high-level exposure. And it can progress much more rapidly, too.
That certainly seems to fit with the case patient's experience only around 10 months of exposure, but already severe findings, like those bilateral bullae you mentioned.
It absolutely does. The case report really leans towards this being accelerated silicosis, driven by the sheer concentration of crystalline silica the worker was breathing in from that volcanic ash. His rapid onset, the severity, especially the bilateral bullae, those are actually quite rare even in chronic silicosis, let alone this fast.
So how is a diagnosis typically made then? Is it just based on symptoms and x-rays?
Well, the diagnosis is usually presumptive initially. It's based on a combination of the patient's history of exposure, what they did, where they worked their clinical symptoms, and those radiological findings from chest x-rays, or more sensitively, ZT scans.
But a biopsy clinches it.
A biopsy like the one done in this case can provide a definitive verification. It tells you for sure what type of pneumoconiosis it is by looking at the tissue itself.
Okay. So once someone is diagnosed, what are the treatment options? Is there like a cure for silicosis?
Unfortunately, no. Our sources are pretty clear on this. There is currently no proven specific therapy that can reverse or cure any form of silicosis. Treatment really focuses on managing the symptoms and preventing complications.
So what does that involve?
Things like using bronchodilators, which are inhalers, to help open the airways if airflow is limited. Aggressive antibiotic treatment for any lung infections, which people with silicosis are more prone to. And providing supplemental oxygen if their blood oxygen levels drop too low.
What about really severe end-stage cases?
For end-stage disease, lung transplantation is sometimes considered as a last resort. The sources also mention some experimental or sort of investigational treatments, like using glucocorticoid therapy, steroids, or something called whole lung lavage.
What's that? Washing out the lungs?
Yeah, basically trying to physically wash dust particles out of the lungs.
Hmm.
But the overall clinical utility, how much these really help patients long-term, isn't firmly established yet for either of those.
Right. And thinking bigger picture, this isn't just an isolated issue affecting maybe a few workers in specific situations. Volcanic ashfall has a much broader impact, doesn't it?
Oh, absolutely. Volcanic ash isn't just a temporary problem during an eruption. It can fall over huge areas and persist in the environment for years. It gets resuspended into the air by wind, by traffic, just by people moving around.
So exposure continues long after the eruption stops.
Exactly.
Yeah.
People can be exposed not only during the event itself, but long afterwards through everyday activities, farming, construction work, quarrying in regions that were affected.
And when you think about how many people live relatively close to volcanoes.
That's a key point. The sources note that a significant percentage of the world's population lives within, say, 100 kilometers of a historically active volcano. So understanding the potential long-term health risks associated with chronic or maybe high-level ashfall exposure, particularly for the people living and working near these eruption sites, is really crucial. There's a definite need for ongoing education and, risk minimization strategies for employers and residents.
It's quite a journey we've taken then. We started with a word invented almost on a whim for a puzzle contest.
We're at P45.
And we've ended up uncovering a serious, complex medical condition and its very real-world implications.
It really is. We started with ultramicroscopic silicovolcanoconiosis, the word everyone knows just because it's incredibly long. We learned it was specifically coined to mean a lung disease from volcanic dust.
But then came that really surprising twist, that current scientific understanding suggests volcanic crystalline silica might actually be less likely to cause silicosis compared to other types. And there's no clear evidence for a unique disease specifically caused by typical volcanic silica exposure.
And yet, we saw this real-world case study. A patient exposed heavily to volcanic ash, likely containing a high concentration of crystalline silica, who developed a severe lung disease.
And was clinically diagnosed using that very long word, probably representing accelerated silicosis from that specific intense exposure.
Exactly. It really underscores the difference between how a word might be coined maybe based on an initial idea or an observed association, and how scientific understanding evolves over time to reveal much more nuanced realities about complex exposures and diseases.
Different types and sources of silica just aren't all the same in terms of their effects, it seems.
The science is always building on itself, refining the picture.
So here's maybe something to think about as we wrap up. We took what seemed like a purely abstract linguistic oddity, the longest word, and found it was actually a doorway into understanding this intricate relationship between geology, environmental hazards, human health, and, well, the ever-evolving process of scientific knowledge.
Mhm.
It kind of makes you wonder, doesn't it? What other everyday words or terms might we use that actually hide surprising complexities? Or maybe even disconnects from the reality they're supposed to describe?